Well, it's been a long journey being the father of someone who has a post-infection disease like long COVID, which is not that different than chronic Lyme disease or fibromyalgia, or, they're all post-infection diseases that have existed throughout history.
So we're here today to talk about an aspect of COVID-19, this terrible global pandemic, that is probably less visible. People have less awareness of, and that is what we call long COVID. This disease that really continues for months after the initial infection. So people who had COVID, and they may have recovered or not, but they continue to have symptoms many months after they get infected in the first place. So that's what we call long COVID. And as it turns out, this is really a huge, huge problem.
So this is our signature event of a year-long series that's going on throughout all of 2022 called Long COVID Research, Policy, and Economic Impact. We are surrounded by experts in a variety of fields, from legal experts to scientists to economic policy experts. We have lived experience experts, people who have gone through this, like myself as a caregiver with somebody who has post-viral illness.
And so today is a step in the direction of getting the dialogue further on what is a national, if not a world crisis.
Our mission at GIC is to explore globally interdependent issues that impact not just the world economies, but also our quality of life. And we can't think of a more important issue than long COVID and how that is going to impact economies and the quality of life going forward.
The fact that you've had 1 million people who died, many have left children behind, and what are the implications of these children in terms of their ability to attain education, jobs going forward in the next few decades?
Today feels a little bit like a victory. So what is it we've learned? How can we take this data? What can we do with it? How can we begin to form arguments that are going to be compelling enough to change the way that lawmakers who are going to fund these efforts think about long COVID?
Letting your country's leadership know this is a thing, and this is something that needs to be addressed. It needs to be addressed by Congress. It needs to be addressed by all branches of the government.
The definition says that the common symptoms are fatigue. That's the number one symptom that people talk about, shortness of breath, and cognitive dysfunction, which a lot of people in real life describe as brain fog.
We're going to have to tackle this problem in many different fronts. Large academic medical centers will do their part. Maybe the private sector can help.
Long COVID's a challenge. It's really hard because you have this population of patients that we don't have answers for. And they're looking to everyone in the industry for answers.
And together we can, overlap our resources to try to understand what's going on so that we can identify therapeutics and start helping our patients.
So what's it going to take? We have to wait 10 years to recognize long COVID is the same thing or very similar to ME/CFS, that it causes the same level of misery, the same level of suicides, the same level of financial destruction. What's it going to take? A step in the right direction is conferences like today.
There aren't very many opportunities where you get to hear from so many different perspectives on something that we've all experienced over the last 2 years that have impacted all our lives. Continuing the dialogue, I think, is really important, and so this was a good step in that direction.
I hope that this event will be a catalyst to changing many minds about what realities long COVID face, and hopefully the loved ones who are who are taking care of others with long COVID will see this as well and will provide the care, support, and education that these communities need.
This was an important element to get everyone together in the same room, but it's not the end. We look forward to continuing the conversation and raising awareness even more.
Can you imagine going to a doctor, not being able to work, not being able to function from day to day, and the doctor telling you, there's nothing wrong with you? We need to get beyond that. And that will give everybody more hope. And I think we have a lot of reasons to be hopeful now because of days like today and the fact that the numbers are getting big enough where people have to start paying attention. It will be addressed. And that's how I give my son hope and anybody else who has this.